How do you know whether your physician is a regenerative medicine expert? Hello, this is Dr. Siddharth Tambar, expert in rheumatology and regenerative medicine, physician here at Chicago Arthritis and Regenerative Medicine. The field of regenerative medicine is growing by leaps and bounds. There's a lot more physicians who are entering the field as well. How do you, as a patient, determine whether your physician and clinic are truly experts in the field of regenerative medicine? In this video, I'll discuss 10 things you should look out for to make that determination. First and foremost, your physician should be a musculoskeletal expert. What I mean by that is that your physician should be dedicated to treating your arthritis, tendinitis, injuries, and back pain. They should be dedicated to musculoskeletal problems. If your physician is dabbling in this, they're likely not an expert in regenerative medicine. For example, if your physician in one room is treating somebody's high blood pressure, in a second room, they're treating somebody's testosterone deficiency, in another room, they're treating their erectile dysfunction, and then they show up to treat your knee or your back, that's not really a musculoskeletal expert. The way medicine works is that you need to be hyper-focused in terms of your specialty and get really good at that over many, many years. That's how you become an expert, and that's how you become a regenerative medicine expert. Number two, your physician should be a non-surgical musculoskeletal expert. The thing about regenerative medicine is that these are percutaneous or needle-based procedures. These are not big open surgeries. This is not arthroscopy. These are done via non-surgical techniques. So how is this relevant? There's a lot of different specialists that are involved in regenerative medicine now. And the reality is that not all of them are really appropriately experts in this field. Orthopedic surgeons, for example, are great and highly trained when it comes to surgeries. So they're great at doing open surgeries, arthroscopies when it comes to your joint problems, and there is a role for surgery in certain end case scenarios. But they don't have the right kind of training when it comes to doing regenerative medicine. Specifically, they don't have the right kind of training when it comes to utilizing image guidance for doing these procedures. And so when you're doing these kind of procedures, you want someone who has a lot of focus on non-surgical management of your musculoskeletal health, and that includes utilizing image guidance for doing your procedures. So number three, to be more specific, is in regards to image guidance utilized for your regenerative medicine procedure. All musculoskeletal procedures, in my opinion, should be done under high-level image guidance. That can be either ultrasound or X-ray guidance. Unfortunately, in the world of musculoskeletal medicine and folks who are doing procedures, they're not always utilizing image guidance. The equivalent of that would be of trying to find a needle in a haystack. The reality is that if your physician is strictly relying on palpation of the skin and then sticking a needle into the body, they're likely not hitting the exact target appropriately. When it comes to regenerative medicine, to get the ideal outcome, your physician should be very specific as to where the needle is being placed and where your cells are being injected. They need to be down to a millimeter by millimeter level or even sub-millimeter level specificity when it comes to doing your procedures. If they're not, you may not be getting your cells injected into the right place, which will prevent you from getting the appropriate kind of response. Because of that, they should be utilizing the easily available tools that any physician in this country can utilize when it comes to your procedures. And that would include a high level of competence and expertise when it comes to utilizing ultrasound and X-ray guidance for your regenerative medicine procedure. Number four, your physician should understand how to utilize inflammation to help you here. That may sound counterintuitive. People think of inflammation as only a bad thing. As a rheumatologist, I know that chronic inflammation can be a real problem. For example, if you have chronic inflammation from an autoimmune issue, that's what causes problems long term. But the reality is that conditions like osteoarthritis and tendinitis, while there's a mild degree of inflammation, they are really more about instability. So about 50 to 60 years ago, steroids or corticosteroids started to be utilized in conditions like rheumatoid arthritis. That sort of condition has such a massive degree of inflammation that steroids can have a benefit short term. However, physicians then started utilizing those same treatments, in particular steroid injections, and started utilizing that for conditions like osteoarthritis and tendinitis. While that will help short term with inflammation, the thing is that osteoarthritis, tendinitis, chronic back pain, these are conditions of instability. And instability does not get better with steroids or steroid usage. Instability gets better with things that improve strength. And so if your physician is relying on steroids and then secondarily trying to utilize regenerative medicine treatment, they likely don't understand that regenerative medicine utilizes acute limited inflammation to start the normal healing process that you would normally have after an injury. Important to understand that, because if your physician is utilizing steroids on the one hand and on the other hand utilizing or offering a regenerative medicine treatment, they may not understand how to utilize inflammation appropriately to get you to heal properly. Number 5, they should understand the different types of biologic treatments that are used in regenerative medicine. There's a number of different regenerative medicine treatments that we utilize, and it's never just one treatment that's appropriate for everyone. So for example, someone who has a mild condition might be appropriate for dextrose prolotherapy or platelet-rich plasma, while someone who has a moderate to more advanced condition might be a better candidate for bone marrow concentrate that has a higher concentration of your own stem cells. The difference is that different cells work for different conditions. So for example, bone marrow might do a great job in someone who has advanced level arthritis. Platelets might not be as successful in more advanced arthritis. Or for example, platelets, if you're 80 years old, you probably need a very high concentration of platelets for your arthritis. If you're 25 years old, you probably need a moderate level concentration. Another example would be if you have a tendon and a joint problem. Your joint needs a very high concentration of platelets. Your tendon probably needs a moderate concentration of platelets. And if you happen to have a nerve issue, well then, if you're utilizing platelets, you want to create what's called platelet lysate, which is extracting the growth factors from the platelets, because that's less inflammatory and better for nerves. So a deep understanding of the type of biologic treatments that are available is necessary. And the reality is that there's a lot of confusion amongst physicians when it comes to utilizing which type of regenerative medicine process to utilize. For example, you may hear nowadays a lot about exosomes. Exosomes have growth factors that can be helpful. The reality is that there's little to no peer-reviewed literature and evidence on the use of exosomes for orthopedic and musculoskeletal conditions. On the other hand, platelet-rich plasma, which has a lot of growth factors, has literally hundreds of peer-reviewed literature, research studies on its success. And you may have physicians that will utilize what looks new because that's what's being sold by a representative from the company to them, but they should be relying on what is actually tried and true. And if your physician is not an expert in what are the different types of biologic treatments available, they may not be guiding you the right way. Number 6, when it comes to determining whether your physician is an expert in regenerative medicine, is that they should be giving you a personalized or bespoke treatment plan rather than a generic one-size-fits-all plan. If every patient who comes through the clinic gets the exact same treatment, that's a case where patients are treated as nails and the physician as a hammer. Everyone gets the same kind of treatment. What's more appropriate is that your treatment plan should be thoughtfully considered and should be tailored to what your problem is. I mentioned that the concentration of your platelets makes a difference based on what your problem is, based on your age, based on your other medical issues. It's important to have that level of personalization when it comes to your treatment decisions. That'll help determine whether or not you're a proper candidate for one type of treatment or whether you should be utilizing a stronger treatment. Or you may not be a candidate at all and you might be better off going for surgery. Your physician needs to be able to have that sort of understanding and that sort of personalization for your treatment process so that you can get the best possible outcome. Number 7, your physician needs to understand prolotherapy and how to treat instability. So in the world of architecture, there's this concept of tensegrity. Tensegrity means that if you take individual units that are weak on their own, if you put them in close approximation and compression, you have an overall structure that is stronger together. This concept in biology or medicine is called biotensegrity. So biotensegrity is important. And the reason why is because this concept of prolotherapy means that if you can strengthen the tissues around the joint, you'll get an overall stronger joint and overall structure that'll give better results long term. So as an example, if you have, let's say, knee arthritis, if your physician is injecting cells only into the joint, you'll get some relief. But the reality is that in wear and tear arthritis, your problem is instability, and the way to treat instability is by treating everything that's driving that instability. So in a knee arthritis example, you would want cells not only injected into the joint itself to help the cartilage, you would then want to treat possibly the meniscus, most likely the ligaments and the tendons that are there to help provide support, likely also treating some component of myofascial tissue, maybe some peripheral nerves as well, and if needed, maybe even the bone. The key there is to treat all those different structures around the joint. All this can be done with the current tools that your physician should have in the office. But if you treat this in a comprehensive manner, and if you treat all the layers of the arthritic process that are involved and treat above and below that as needed, what you'll get is progressively more strengthening over time, better stability over time. What that'll lead to is less inflammation over time, which will then progressively lead to less pain, better pain relief, and better function, and an overall better outcome and better quality of life. But your physician needs to understand that concept of prolotherapy and how to treat instability. This shouldn't be just a one-shot injection. This should be a comprehensive treatment approach. Number 8, when it comes to determining whether your physician is an expert in regenerative medicine, they need to be transparent regarding results and your candidacy for treatment. So we talk about this being a relatively newer field of medicine. The reality is that there's actually a significant amount of data behind this and a significant amount of experience. The original prolotherapists who were utilizing a milder version of regenerative medicine have been doing this for decades. The first physician that I know of who started utilizing bone marrow stem cells was Philip Hernigue, French orthopedic surgeon that was treating knees and shoulders, and he had started that in the mid-1990s. The Regenetics Network has been involved in regenerative medicine since 2005. My personal experience starts in 2008. So these treatments are new, but they're not brand new. There's a lot of experience behind this. And if you're paying attention to the literature, and if you are coming from a place of experience, then you'll understand who is an appropriate candidate for treatment and what's a realistic result. They'll also be able to guide you in terms of how can you possibly improve your candidacy if there's room for that, or if you're a candidate for a different procedure that might get you a better result. That sort of approach requires experience. If your physician is taking the attitude of, not sure if it's going to help, why don't you try it, it's low risk, that's not really giving a lot of confidence. I think your physician should be able to tell you what are the chances that you're going to get a good result, depending on what the result you're trying to achieve. They should be able to tell you whether you're a good, fair, or poor candidate, and they should be able to tell you whether you should be considering that as a treatment or not. Number 9, your physician should follow your results long term. The nature of medicine these days is that if you go in for your procedure, you may not even see your physician before your procedure. There's a good chance you'll never see that physician again after your procedure. That's a really bad way of how medicine works right now in this country, unfortunately. Really, the proper way to do regenerative medicine, or for that matter, any procedure, is that your physician should be there to guide you before your procedure, during your procedure, and after your procedure. End of the day, we're not just technicians, we are physicians, we are doctors, and we're here to take care of human beings. And a lot of that means that we are here to follow your results long term. And a big part of that is because results are variable. Humans are different, and how they respond to treatment is different. And knowing how to help you out after your procedure, whether that is helping to guide your exercise and physical therapy after your procedure, whether that is months later, whether to help determine whether you would benefit from a booster treatment, or if there's any signs of any complications, helping to guide you through that as well. Your physician needs to be there to help you out long term, partly because that's the right thing to do from a procedure element, but more importantly, that's the right thing to do as a physician, that they should be there to help you out long term. And lastly, number 10, What your physician should have, if to prove that they're an expert in regenerative medicine, is that they should be able to guide you through the whole process. They should understand what makes a good candidate. They should understand how to optimize your treatment. They should be able to follow you through the process. They should be able to answer all your questions. They should be there to work as a physician to help guide you through this whole process. As I've mentioned, while these treatments are newer, they're really not that new. They should have an understanding of how to guide you through this. Patients have questions, which is natural and normal, and your physician should be available to not only answer the questions, they should be able to tell you, here are the other questions you should have. You should also be thinking about what are the potential risks? How do we get you the best kind of outcome? They should be able to guide you through the whole process. Again, we're not technicians only, we are physicians, and that sort of connection with the patient to actually guide you through the process is essential if you want to get a good outcome, and is essential if you want to figure out if your physician's really, truly a regenerative medicine expert. Great. Thank you for your time today. If you found this helpful, give us a like, subscribe to the channel. Until we connect again, have a good day and live well. Bye-bye.